Alex, and I'm a pediatric nurse practitioner student, and I'm going to be performing a HEENT physical exam on a 10-year-old female today. So initially I'm going to be looking at her head, and I see that it is normocephalic without a traumatic, with no masses or lesions noted. I see that her hair is well distributed. I look at her face, and I see that her face is symmetrical, also atraumatic. And then I look at her sinuses, and I'm going to palpate for her frontal sinus. Any tenderness? Any tenderness here?
No.
Paranasal and frontal sinus is non-tender on palpation. And then I'm going to move to her eyes. Her external eyes are symmetric. Her eyelids and her external eyes are with no periorbital edema. Her sclera is white. Her conjunctiva is clear, non-injected. And I'm going to use the scope. Okay, and I'm just going to look at your pupils real quick. Pupils equal round and reactive to light. You just follow it in real quick. Perfect. Her corneal light reflex. Her corneal light reflex is symmetric bilaterally. And can you just follow this for me real quick, my finger? I'm checking for extraocular movement in the 6 fields of range. Perfect. Good job. And I'm looking for some strabismus, and no strabismus is noted. And then I'm going to do the cover uncover test. You just look across the room real quick. Okay. Perfect. 2 more time. Good. And no strabismus is noted. And then I'm going to look for her red reflex. You just look at me right here. Perfect. Good. Good. Red reflex was elicited bilaterally with no opacities. And then I'm going to look at her nose. Her nose is midline with no deviations, atraumatic, and it's smooth. And then I'm going to look in her nose. There's patent bilaterally. Nasal mucosa is pink with her septum is non-deviated. Her turbinates are pink. I see no masses or lesions and no polyps and no exudate. And then I'm going to look at her mouth. Whew, I'm out of breath. Her lips are pink and with no lesions as well. And then I'm going to look inside. Thank you. Oral mucosa is pink. Buccal mucosa is pink with no lesions or masses noted. And you're doing well in sticking your tongue out. Thank you. Tongue is midline, strong protrusion. Can you say ah? Ah. Posterior pharynx is pink with no lesions intact. Her teeth, she has 24 teeth that are coming in well. And then her tonsils are 2+ bilaterally with no exudate or lesions noted. And then I'm going to assess the range of motion of your neck. So when you turn your head to the left, to the right, up and down, and good job touching your chin, your chest. Can you look all the way up at the ceiling? Perfect. I'm just going to feel real quick, okay? No cervical lymphadenopathy. No masses noted. Trachea is midline. I'm going to come around until your thyroid. Thyroid is symmetric with no nodules. And firm. Let me have you just do this one more time, and then I'm going to ask you to swallow. And then I'm going to look at your ears. So ears are symmetric bilaterally with the top of the pinnae symmetric with the outer canthus of the eye. Any tenderness on your pinnae?
No.
Or your tragus? No? No tenderness?
No.
No? Perfect. Okay, I'm going to look at your ear. External auditory canal is patent with no lesions, no cerumen noted. Left, or this is the right tympanic membrane, pearly gray translucent with good mobility. The cone of light reflex is at 5 o'clock. And then I'm going to come to your left ear. External auditory canal is patent with no cerumen noted, no masses noted. Her left tympanic membrane is pearly gray translucent with good landmarks, and her cone of light is at 7 o'clock. And that concludes the HEENT video.